Okay, this is just a quick overview on a in-class activity to help y'all practice just a couple of regional terms, anatomical terms in anatomy. It's a little fake case study. Patient is brought into your hospital and has been in a skateboarding accident. She has some injuries that you need to assess and describe to your staff. First, you assess her lesions and damage to her integumentary system. And the first question is, what is the integumentary system? You should be able to figure out that that is skin. And if you are not, then it is in your lecture slides, the 11 systems. You can also take a look in the book and you can also Google it. Integumentary system is skin. There are 11 body systems. We don't go over them in great detail, but we will study them because this is a systemic approach to anatomy. So the integumentary system is skin. The second question says, use the diagram above to mark her injuries with the letters corresponding to each region. Her lesions can be found on A is the mental region. So I have an A here because I don't have the capacity to do a fancy drawing. There's an A for the mental region or the chin region. Then we have B is the antebrachial region. So that is the antebrachial region. We can just copy that and move it right there. B would be the antebrachial region. Ante for forearm, or before is that prefix, and brachial is for the arm. So antebrachial is the forearm region. C is the frontal region. The frontal region would be right over here, the forehead. You can look up these terms on your lecture slides, figure 1.11, I believe. D is the right and left palmar region. So D, bear with me, y'all. I know this is a terrible way to do it. It's much easier to just print it on a piece of paper. You can also print it on a piece of paper and take a picture and upload it. So E is the right and left palmar region. And one of the things that we want you to practice in anatomy is identifying anatomically correct right and left when looking at a picture. So then we have the left patellar region. D is the palmar, and then E is the left patellar. So this would be her left patellar. So that would be D goes to both palms, palmar for palms, right and left. E is the left patellar. The patella is the sesamoid bone in the knee, and we are going for her left side of the body. And then number 3 says she also has some bone fractures and bruising. Her left medial tarsal region is swollen and bruised. Mark this region with a number 3 on the diagram. Can you think of which bones may be fractured? So number 3 on the diagram, we want the left medial tarsal region. So there's the tarsal region, or the ankle. You have tarsal bones, those are the ankle bones. And then left side is this side, and then we have the medial side of the ankle. So medial is more towards the midline, whereas lateral is more away from the midline. Away from the midline versus towards the midline. I don't expect you to know any bones right now, but you could probably take a guess and say maybe a tarsal bone, maybe the tibia, the big weight-bearing bone, or your shin bone. It's got that bony bit on the medial side. It could be heel bone. We don't know. Really, the answer is Saloom. We don't know. We didn't take an x-ray, right? That would be really the way to find out. But I just want you to be able to guess at this point. Then it says, this rad shredder also took a big fall and landed on her abdominal region. She may have internal bleeding in the left iliac region. Mark this number 4. Left iliac, let's change my number 3, or let's copy my number 3. I am an elder millennial with a 4, and the left iliac region, so we've agreed this is the left side of the body. Left iliac would be one of the 9 abdominal pelvic regions. It's named for the iliac spine of the os coxa. So you have this being the left iliac region right there. And then she also, last one is she also reports dizziness and nausea. Which of the body's organ systems may be responsible for these feelings? Discuss in your group. What I want you to discuss there are, there are 2 things here. We're actually figuring out which body system could be controlling a dizziness and nausea response. And the second part of the question is just naming a body system. We go through various body systems this semester, like the cardiovascular system, the nervous system, the urinary system, the musculoskeletal system. These are all body organ systems. Which ones would be responsible for dizziness and nausea? Well, the obvious ones would be maybe the nervous system, right? If you hit your head or you feel some sort of dizziness, it could be due to a trauma to the head. It could be due to a concussion. And then another obvious one would be that we're kind of all familiar with is the digestive system. If you don't eat, you get nauseous, or if you eat something really yucca, we know there's a connection with the digestive system and the feeling of nausea. And then the last one that lots of folks don't really guess right away is the endocrine system. So that would be the glands, the body's endocrine glands, like the pituitary gland and the adrenal gland, chemical signaling to a far away from one tissue to a faraway target. So the endocrine system may be responsible for that. I just want y'all to be able to name some body systems here. Pretty quick, easy activity. Went over it in 7 minutes.